that the human capital outcome is focused on the basis of its employees. And this often involves an in depth knowledge of acquiring information that is based on the current and potential improvement for the hospital organization. It is during this process that the focus and the awareness of the investment within the organization on the employees is addressed. And this can include acquiring data such as what has previously listed, which is based on competencies of nursing staff and trainings. This is overall to help improve patient outcomes. And though this is a very difficult process of evaluation, once it is addressed, it can lead to an improved resource utilization and innovation within the workforce. So organizational management or improvement, I should say. Some of the implementation of the strategies for improvement within an organization that is hospital based is based on skill based hiring or utilizing a range of recruitment channels, as well as addressing organizational biases within the network or offering mentorship or coaching opportunities. And this ultimately can help assist in establishing relationships with other professional associations. Improving hospital organizations can take a lot of willpower, strategy, initiative, and planning. The care coordination that goes into development of a hospital organization is not easy. However, it is necessary that when focusing on the current strengths of the employees, that it is done on the current and future needs of the organization. That way, you're able to truly gauge the employees within the hospital organization through effective investment. And this can also include evaluations, coaching, career developments, competencies. And by performing these necessary assessments, it establishes a foundation that can allow input from other stakeholders, as well as I previously stated, professional associations. So, in part of developing and integrating human resource leadership, it can be divided into segments, and this can range from establishing a strong foundation on policies, recruitment framework, administrative tasks, as well as adding some more professional or experienced HR staff that can handle increased volume of staff and recruiting, as well as cross training. Excuse me. And based on the hospital needs, as previously stated, it's necessary to integrate principles that are ethically and morally correct. Because although we are human resource management, we are also based on Christian foundations and principles, which ultimately changes your course of work because you have to make sure that you are integrating a strong foundation of policies that are being fair in treatment, um, and also being fair in the way that you are executing plans while still maintaining a Christian worldview, which allows for a culture of positivity and inclusivity. So, part of that promotion of Christian principles is aligning practices with biblical principles, which falls under the characteristics of integrity, kindness, compassion, compromise, and even fairness. Human resource management is critically important and necessary, but especially within the hospital organization because we are going on the basis of treating patients and treating and providing that servant leadership. It is important because it allows the performance and the benefits of the healthcare system to deliver largely on the basis of knowledge, skills, and motivations of those who are responsible for delivering those said health services. And this is just an example of what the human capital within the hospital network looks like. Some recommendations to meet organizational needs, especially in the healthcare organization, would look like comprehensive needs assessments or data-driven decisions or prioritization. We also look at, like as previously stated, the investments. So maintaining transparent communication as well as modernization of employee laws, such as FMLA and Affordable Health Care Act. And in the healthcare setting, as it is continuously evolving, it is important that appropriate channels of implications are used towards helping establish an improved organization. Especially when assessing the needs of a healthcare organization, it is necessary that areas of innovation are welcome to ensure a high functioning organization. And this is ultimately based upon the sustainability of delivery of care. And this is kind of a visual representation of what I just discussed on how the process of developing an organization within the healthcare network. So, because there has been such a large range of knowledge that I've learned throughout the course of this class, um, ultimately, utilizing these tools from this course will allow me, as a future human resource professional, to showcase employee developmental plans and awareness of current policies involving employees, how to appropriately address that, how to empathize with that, especially having a Christian foundation, and implementing practices to enhance staff engagement and culture. This also looks like addressing the weaknesses and strengths of my staff,